Hello, everyone, and welcome to the Code of Ethics and Standards of Practice for Educational Interpreting. So, if you are watching this, more than likely at some point in your time here at Melrose that you have either done some translating or you've done some interpreting. Maybe that was conferences, maybe that was a phone call, maybe that was interpreting something a teacher said or translating something a teacher said for a student, or sometimes it's for, like I said, more private information, like a parent-teacher conference where you're taking information from the teacher and relaying it to the families, or vice versa, taking information from the families and relaying that to the teachers. And some of the information can be very private, confidential information. So we want to make sure that everyone's on the same page, which is why that is the purpose of this training. So why does this training matter? Okay. And we want to make sure that we're ensuring meaningful communications with their families. A lot of times, you really represent our school when you're translating to our families that don't have English as a primary language. And so they're going to relate their opinions or their feelings about the school and on the job that you do as well. So you have a role in that. We want to comply with federal law. So federal law says that we do need to have this type of training, that if we have people doing interpretations or translating, that we have put them through a kind of a code of ethics training. We want to make sure that we're upholding professional standards and what is allowed and what is not allowed when we're having these conversations. And remember that you represent a professional organization. And what does that mean? And then we want to protect student and family dignity and confidentiality. Again, as I mentioned, you are privy to a lot of information about families and about from students, that the general public doesn't have access to. And so just understanding that confidentiality is so important, and treating families with respect is so important, because it's a very vulnerable state that they're in when they have to use a translator or an interpreter, to express what they're feeling or what's going on with them. Right. So it's a really important that we have this type of training. What is interpreting? So interpreting is conveying messages between language. It can be at IEP meetings, it can be at evaluations, conferences, phone calls. There's many different settings where you might do some interpreting. The focus today is on spoken language. It's very distinct from the aid or paraprofessional duties. It is different in what you're doing, because it's just a little bit more as far as the translating piece and what is expected of you, interpreting piece. What is the role of an interpreter? It's to facilitate communication between the parties. We want to have open dialogue. We know in education we can't do anything without our families, and so we want to have a good line of communication with our families, and that's where you come in. We want to remain neutral and professional, and so remember that you're taking the message and just relaying it on. So you're neutral. You're not putting opinions into it, or facial expressions or body language that shows that you're reacting to anything that's being shared at all. You're simply taking the information and giving it to the next person that needs to hear it. And then we want to avoid multitasking. We want to be fully present with the conversation. So you're paying attention, your eye contact, you're engaged, right? That eye contact is important, where you're not just kind of staring off into space. You're looking at the person that's talking, then you're relaying to the next person that needs to hear it. There are different types of interpreting. So there's consecutive, where there's pause, interpret, pause. There's simultaneous, interpret while the speaker's talking. So consecutive would be someone says something, you listen to it, you interpret it back, you pause, you listen to them, right? That's probably the most common. Simultaneous is where they're talking, the teacher's talking, and the interpreter's talking at the same time, just mimicking or mirroring what is being said, right? And that can be appropriate too, where the teacher's talking and then you're talking right alongside of them, just word for word what has just been said. Or you can just take the information and relay it. Cite is when you're reading aloud a written document or another language. So sometimes maybe a teacher has this sheet of paper, right, and they're explaining what's on the sheet of paper. So you might have to interpret that to a family as well. Okay, so which type do we use most often? To me, I really think we do a lot of our consecutive and the simultaneous type of interpreting when we're talking about conferences or IEP meetings or whatever type of meeting we're having with families. Pre and post sessions. So this is important. It's not always possible, but if it is possible to meet beforehand to review the purpose, documents, and context, so you know what's going to be shared ahead of time, is always beneficial. And again, that's not always the case, but maybe you have 5 minutes before a conference starts, right, or a couple minutes to touch base. Hey, is there anything that really big that we're going to be hitting on? So you have some of the background before going into it. Same with an IEP. And then debrief after. If you feel there's some cultural misunderstandings or something that wasn't relayed that you feel like you need to share, make sure you're scheduling a post session with the teacher or the staff member that you're working with to kind of debrief what had been talked about. And when you are starting interpreting, you always want to introduce yourself and your role. So when you're in the interpretation session, you should be saying, hey, my name is this. I'm going to be doing this for today, to both parties, right? So introduce yourself. So otherwise it's not just some person sitting here. because you play an active role in what's going on. And so they should kind of feel comfortable and know who you are. Today, we're going to be talking about 9 ethical principles when it comes to interpreting. Okay, and these are the different categories: confidentiality, accuracy, impartiality. Okay, I mean you're not putting your opinion into it. Professional boundaries, cultural awareness, respect, advocacy, professionalism, and continuing education. So these are the 9 ethical principles when it comes to interpreting that we're going to be going through, and these are actually laid out from the state, and so they help me kind of design this presentation. First is confidentiality. You have to maintain the privacy of all student and family information. Only share with authorized staff and be aware of mandated reporter responsibilities. Meaning, if something is shared with you in another language that the teacher doesn't know, but you feel like it constitute mandated reporting, physical abuse, any kind of abuse, neglect, you are a mandated reporter and you do have to report that. Right? You don't have to say that right there, but you just know that if you take information that you know that you've heard, that you are mandated to report that. You cannot be discussing anyone's information in public about anything. Again, you're privy to a lot of information. It's a very vulnerable spot for a lot of our families to be in. They have to share things through you and make sure that stays with you. Okay, it's an absolute must. Here is a scenario. After an IEP meeting, a staff member asks the interpreter in the hallway, "So what's the student's disability?" The interpreter politely declines to answer, saying they can't share confidential information. Is there any information from a session that is okay to share with others not involved? And the answer is no. Obviously, if the teacher was present there, then you can share it. They're authorized. They're part of that meeting. But like, for example, if I'm not at the meeting, right, it's not, I don't need to go up there to you and ask those types of questions. That's not, you can just refer them back to the teacher. Oh, if you had something you're curious about, please talk to so-and-so's teacher, right? We want to stay confidential, and that's anywhere, right? If someone's in public and someone's grandma says something to you about something, hey, I heard you met with my grandson. How are they doing? Oh, that's confidential. Please reach out to their parents, or please reach out to the teacher if you want more information, right? Staying confidential is very important. Accuracy. Interpret everything completely and accurately. Avoid summarizing or omitting information. Reproduce the tone, intent, and cultural context, and ask for clarification if needed. So we don't want to take what they said and just kind of put it into our own words necessarily to say. We want to, as best as we can, exactly interpret what was being said, even if it makes us feel uncomfortable. Okay, even if they're saying something that's you don't feel personally believe, or you don't feel as appropriate, communicating that with the staff member, we want to be as accurate as possible, and we don't want to leave things out. If they said something kind of not meant for the teacher, staff, whatever, we still want to share all of that. We want to make sure we're reporting accurately, and if you don't understand what's being said, please ask for clarification so you're not making up what you think is trying to be said. If what they're saying is not making sense to you, or you don't know how to convey that message, communicate to the staff or the families, hey, can you repeat that? Or I don't quite understand what you want me to say. That's okay to say that, because we want it to be as accurate as possible, not you trying to figure out what the other person is saying and then putting your spin on it. We want it to be exactly what each person is saying. Here's a scenario. During a conference, a parent expresses concern about their child's behavior at home. The interpreter omits some of the parent's emotional words to avoid making things uncomfortable. This alters the tone and accuracy of the message. Should the interpreter soften or filter the emotional content? The answer is no. Right? Your job is to kind of exactly mimic, even if you don't agree with what was being said, to both sides, what was being translated. Next is impartiality. We talked about this earlier about staying neutral. Don't put your opinions in it. Disclose any conflicts of interest and avoid personal involvement. So if you're interpreting for a family that you've had previous run-ins with, and you have some sort of conflict, maybe you're a relative, and you don't feel like you can be impartial, then you need to communicate that out early. I don't feel comfortable. The reason is this. Then we need to find somebody that is going to be able to be impartial to do that, right? So make sure you disclose that information. Don't involve yourself into the conversation where you're putting your own opinion and saying, oh, that's awful. I can't believe they said that, or I can't believe that happened to them. That shouldn't be happening here at the school. Again, the role is to take in the information, relay it back to the next person, and not insert yourself into that conversation or your opinions or feelings of that conversation, which can be hard. The interpreter, here's a scenario. The interpreter knows the parent from the community and agrees with them that the school hasn't done enough. During the meeting, the interpreter subtly emphasizes the parent's frustrations. How should the interpreter handle prior relationships with participants? So in this case, they know each other in the community. They have a strong opinion about it. It's okay to say, I'm going to have a tough time being impartial in this conversation. Can we find somebody else? So instead of kind of putting your chair next to the families and saying, kind of attacking the teacher because you're with them and you're on their side of it. We would rather you just find a new interpreter because, again, it's about staying neutral, and goes back to the accuracy piece of it. Professional boundaries. So we don't want to blend the roles of interpreter and advocate during the session. Okay. Politely step out of the role if needed and explain why. No personal favors or side conversations. So professionally, again, it's about not inserting yourself, right? We're there to interpret, but we don't want to be the advocate and say, well, this is what this person needs, because now that you've become the advocate, you've decided what this family needs or what the teacher needs, and now you're making decisions. For that one, it's really the family's job and the teacher's job in that situation to make the decisions. Um, if you feel like the lines are getting blurred or the families are having too much, trying to have side conversations, then remove yourself from the role and explain, right? I feel like this is getting too personal. I think we need to find a new interpreter to finish this conference or finish this IEP. And no personal favors or side conversations, again, where you're talking back and forth about something unrelated that you're not relaying back to the staff member or the same teacher to you, back to the family. We want to make sure that those side conversations aren't happening, that it's a direct conversation. The conversation is really between these two people. You're in the middle, just back and forth, not you here having a conversation, you here having a conversation, and not relaying that what was being said to the other person. Here's a scenario. The interpreter is also a school paraprofessional, which is common for us. During a meeting, they are asked to explain the special education procedures to the parent in their own words. Okay. When should an interpreter step out of the role and how? That would be an example, right? It's not your job to try to explain that procedure. Step out of the role and say, okay, they're asking this. I don't know how, I think that you need to be the one to describe that for them. So I'm stepping out of the role of interpreter for now. I'm asking that you describe what the special education procedures is, and I will relay that message back to the teacher. So that stepping out and leaving completely, but removing yourself from just the back and forth and saying, hey, this is what was said. I want you to describe the procedures. It shouldn't come from me, and then move on back into the interpreting role. Cultural awareness. Be aware of differences in norms, beliefs, and practices. Clarify misunderstandings rooted in culture. Work with staff to ensure culturally responsive communication. So just remembering that every culture has different values, have different morals, and just being respectful of that when we're having those conversations. A scenario is the team recommends daily speech therapy. The interpreter knows the family believes speech delays are a natural phase and may be offended. The interpreter shares this cultural perspective after the meeting in a private conversation with staff. When it is appropriate to discuss cultural misunderstandings, that's a great example of post-session, because then the teacher's going to be, or the staff might be confused about, why the parents aren't, as concerned. But if you have that type of information about the cultural awareness of it, relaying that to the staff member is completely fine. So that they're aware of this is why they may be so hesitant. So then we can make an informed decision on what to do next. But that's why we talked about if you can have a post session, especially if there's something kind of not icky, but something that was like a miscommunication or something where that we weren't all on the same page, and you feel like, yep, I need to debrief with the staff member afterwards. That's okay to do, right? To debrief that, especially when we're sharing some of those cultural beliefs and norms. Respect, pretty clear one. Just treat all people with dignity, collaborate with colleagues, resolve conflicts personally. So again, making sure that we're being respectful of families, being respectful to staff. If you have a conflict personally, don't be in the conversation, right? And so if you aren't able to show the mutual respect to the family for some sort of reason, or to that staff member, maybe you have some sort of, I don't know, disagreement, or you haven't always been on the same page with that staff member, don't be the interpreter in that one then again, or you have to find ways to resolve that so that you can demonstrate that respect to both parties. And likewise, the staff members and the family members should be showing you respect as well, because you are an active participant in that meeting. A scenario, a team member makes a joke during a meeting that the interpreter knows may be offensive in the parent's culture. The interpreter respectfully conveys the joke but flags the issue to the case manager afterwards. How can interpreters address disrespect or insensitivity appropriately? Right? So that's one. We talked about stepping out of the role too. You hear the joke, you know that might be interpreted poorly, right? To the family, stepping out and saying that to the staff member too, and saying, hey, that might, that joke might not be funny for this reason, right? Is showing both parties respect, right? Maybe the staff member didn't intend it to be offensive, right? They didn't know. And we don't need to offend the families unnecessarily either, right? but even having that debriefing session and explaining that further is a good way. It's a good example of where they continue to relay the message, but you could also, again, step out, remove yourself from the scenario to express some of that, and then continue into the conversation. I think that shows respect to all parties. Advocacy. Okay. Only step out of the role in serious cases like health and safety. It must be very urgent and justified. Always state that you're stepping out of the role in both languages. Okay. So where you have to step out and be an advocate, meaning that you have to defend somebody or something, right? Or you have to kind of insert yourself into it. Make sure it's got to be very important reason why you're doing that, and also justify to the both sides why you're going to step out of the role of interpreter. Um, some sort of reason. Okay. The scenario is the interpreter realizes the parent doesn't understand what an IEP is, even though the term has been used repeatedly. They step out of the role and say, I'd like to clarify to the parent is not understanding the term IEP. Can we explain it more clearly? Okay. That is a perfect example of you have to play advocate. This is important for the for the meeting, right? You know that the student and that the parent's not going to make an informed decision because they don't know what an IEP is. You've gathered that information. You're stepping out. You're saying to the teacher, this family doesn't, it's clear that they don't understand what an IEP is. Can you explain that further? And then you go back in the role of interpreting. I think that shows professional boundaries. I think that shows respect. It's a perfect example of you didn't blend the role of interpreter and advocate. You've said, I'm stepping out of the role, okay, to the family. I'm stepping out of the role of the teacher. I'm telling them I'm stepping out of the role. This is the reason, right? And then you can go back in. Okay. But that is when it's okay to be advocate, but it really has to be. An IEP is a good reason. Or if there's like a really big health issue or safety of the student or anybody, then you have to step out of that role. But be very cautious when you do that and make sure that you clearly communicate that with both sides. Professionalism, just be prepared, be punctual, dress appropriately, take breaks when needed. So just be a professional. Make sure you're not showing up late, acting like you'd rather be somewhere else. We talked about having eye contact with both sides when you're doing that, showing that you're engaged, nodding like you're taking information, asking clarifying questions if you need to, but be present, be professional while you're there, and keep the conversations about what's supposed to be discussed at that meeting. And lastly, for the ethics of education, ethics of interpreting, we have continuing education, which just means staying current with what's going on in the school, right? Attend trainings, keep developing language skills, help mentor others. When you can, come to the in-service days. Read newsletters, know what events are happening in the school so you can be informed too, so you're not caught off guard with a question. Maybe it's about the Dutchman Fun Run, right? Or maybe it's about the Christmas concert. Know when those things are going on. Read the newsletters, read the memos, pay attention to those things so that you can clearly convey that message too, and speak with confidence because you yourself know about it, and then you're hearing what's being said and you can relay it in a way that makes sense, or make sure that that it's being relayed accurately to the other person. But just stay involved, stay up to date on what's going on, and just grow as a professional with anything, right? No matter what the role, we can all grow and learn. Continue to be a lifelong student even in your professional roles. A scenario: a new interpreter is asked to interpret for a psychological evaluation but has never interpreted in that setting before. They inform their supervisor and request time to observe a session or receive training first. Perfect example of taking ownership of their education, right? They don't know anything about that evaluation. So hey, can you just give me a little background? Maybe that's a pre-meeting, right? Can I have a pre-meeting with the school psychologist to go over the evaluation so I know what kind of questions are going to be asked so I can feel prepared, right? You have every right to ask those types of questions, right? Making sure that you feel comfortable going to the meeting, especially in it's a setting that you're not used to, right? Maybe you're really used to doing conferences, you're used to how they flow, but if you're not, connecting with a peer that has so that you can kind of debrief with them, like take ownership of the things you don't know and not go into a situation feeling completely blindsided by what's being discussed. Okay, I'm going to discuss just some scenarios for you that I feel like are pretty relevant and I feel like that are things that could happen, and just to see how we might respond when in those situations. Okay, so this first one, just help her out. A case manager asked the interpreter to help the parent fill out a consent form after the meeting, saying she'll understand it better from you. Okay, absolutely not. The right thing to do is kindly decline. Explain that your role is limited to interpretation. Suggest that the staff member review the form directly with the parent, using you as an interpreter, not as the explainer. So they shouldn't be giving you something and saying, okay, just translate this and have them fill it out. Right? Nope. The parent should be talking, looking at the family, and explain, okay, this is where your name has to go, and then you would interpret that. Right here, I need you to put, they're the one, it's not your job to do, your job is to interpret, right? So they shouldn't be giving the job. That's professional boundaries, and that's accuracy. Okay. Skip that part. A teacher asks you to skip a technical part of the report during site translation. If this is a report and you've sat in conferences and they've talked about that report with the family, we're not omitting information. Staff members shouldn't omit information either. Okay. So you have to kind of explain, no, I need to interpret the entire document to maintain ethical accuracy, right? Because you don't know if the teacher just doesn't want to take the time to do it, right? You don't know. This is the report that's in front of the family. My job is to make sure that that report is done to fidelity, right? And says offer to pause if the staff want to summarize it before you interpret. Okay, but yes, again, you're not skipping things. And if a teacher's having a conversation, oh, just don't say that, leave that part out. They need to know better too, that they can't, it's whatever is being said, is to the family. And they, like I said, teachers should be looking at the family. They shouldn't be looking at you, the interpreter, either. They should be looking and making eye contact with the family, okay, and showing that level of respect and not skipping things because of time or whatever the reason might be. Everyone knows her. You're assigned to interpret for a family you know well from church, including sensitive topics. Disclose the potential conflict of interest to your supervisor and request a reassignment to maintain impartiality and confidentiality. If you have a relationship with them and you feel like I can't be impartial, or you don't really want to know their personal information because you feel like it's not your business, and you're so close to them, you don't want to have that awkwardness between them, just disclose that. You have every right to feel comfortable in the interpreting session. And we want to make sure we want everyone to be comfortable. And the family might not be very comfortable with you there either because of how close or how well you know each other as well. Are they going to label my kid? A parent privately asked you what the team is really trying to say. Okay. Again, you needed to be accurate back and forth, and that eliminates the side conversation. So you had to encourage the parent to try to question the team, okay, and interpret exactly as they ask. Do not summarize or kind of give advice. Really encourage the family. If you're concerned about something, ask the question, and I'll relate to them, and they will answer it. And again, not inserting yourself into it, right? Last one. What do you think? During an assessment, a specialist asks if a child's speech sounds right to you. Again, you are there to interpret, right? Politely explain that you're not qualified to evaluate speech or give linguistic assessments. Suggest the question be referred to a bilingual specialist or a speech pathologist. Okay. It just really, again, this training, the main part is to clarify what are our roles, right? Okay. We want to know our role and we want to stay in it. Okay. Interpret accurately and completely. We want to respect confidentiality and cultural dynamics. We want to step out of the role when necessary, and we want to commit to continually improving ourselves in our own education and making sure that we're not going into things blind. Okay. And this goes both ways. I'm not talking families doing side conversations. Teachers do it just as much, right? And so it's going to be kind of hard to say, I'm not going to engage in that, or no, or that's not my place. Teachers should be aware of going into conferences too. And I'm going to share this slideshow with them to know that what we're expecting of you, so they know not to engage in those things either, and put you in a weird spot where you have to say no, or that you're not going to do that, or that's not your place. We want our staff members to know how to use interpreters and work with and collaborate with interpreters properly, so they don't put you in uncomfortable situations too. Okay, want to thank you for all you do. I mean, without you and your ability to translate and interpret it for our families, we really would be lost. We can't do anything in education without the support of our families, and you serve as a necessary bridge for that. What you're doing is important. It's a really important work in helping us build connections with all of our families here at Melrose area. And so just thank you for that, and I appreciate you taking the time to watch this session.